You know that feeling when you get a lab report back and it's just full of acronyms you've never seen before? Well, today we're going to tackle one of the most common ones, the AST blood test. We're breaking it all down using info straight from the experts at Medline Plus, which is a fantastic resource from the US government. So let's dive right in.
All right, so here's our game plan. First up, what even is an AST test? Then we'll get into why you might need one in the first place. We'll walk through what to expect during the test itself, decode what those results actually mean, and finally put it all together to see the bigger picture.
All right, section 1, what is an AST test? Let's really start with the basics here, because before we can talk about what the results mean, we've got to know what they're actually measuring inside your body.
So the AST test measures a very specific thing in your blood, an enzyme called aspartate aminotransferase. Yeah, I know it's a mouthful, which is why everyone just calls it AST. Now, what's an enzyme? Just think of them as let's say, the construction crew for your body. They're these little proteins that help speed up all the crucial chemical reactions that keep you running.
Okay, so where do you find this AST enzyme? Well, it's mainly found in your liver, which is why it's so often called a liver test. But, and this is a really important but, it's not only in your liver. You've actually got smaller amounts of it in your heart, your muscles, and a few other tissues. And trust me, that little detail is going to be crucial when we start talking about the results.
So here's the whole idea behind the test, and it's actually pretty simple. When your tissues are healthy, the AST enzyme just stays put inside the cells, doing its job. But what happens when those cells get damaged, maybe from an injury or a disease? Well, they can break open and release that AST into your bloodstream. So when a blood test finds high levels of AST, it's basically like a flare signal. It's telling your doctor that, hey, some cells somewhere in the body are damaged and need a closer look.
Okay, that brings us to our next section. Why might you need one? We know AST can signal cell damage, right? So that leads to the obvious question, why would your doctor decide to order this specific test for you?
Well, a really common reason is that you're actually showing symptoms that could point to liver problems. You know, things like feeling nauseous or really tired for no reason. Maybe you've noticed jaundice. That's when your skin or eyes start to look yellowish, or swelling in your belly. Even things like dark urine or frequent itching. Any of those could be a red flag, and an AST test is one of the first tools a doctor will use to investigate. But here's the thing, it's not always about symptoms. Your doctor might order an AST test just to be proactive. Let's say you have some known risk factors for liver disease. Maybe it runs in your family, or you have obesity or diabetes, or perhaps you're taking a certain medicine that's known to be a little hard on the liver. In those cases, the test is a way to keep an eye on things, to catch any potential issues early on.
Moving on to the test itself, what can you expect? The good news is, if you're picturing some big, complicated procedure, you can definitely relax. It's actually a super simple, quick, and low-risk thing.
It really just boils down to a few simple steps. For preparation, the most important thing is to just tell your provider about any and all medicines you're taking. Sometimes they'll ask you to fast, but that's usually because they're running other tests at the same time. Then there's the blood draw itself. A small needle in your arm. It takes less than 5 minutes, really. And afterwards, you might have a tiny bit of bruising where the needle went in, but that usually fades super fast. And that's it.
All right, let's get to the part I'm sure you're most curious about, decoding your test results. This is often the most stressful part, right? Seeing that number, especially if it's flagged as high. So let's break down what it could all mean.
Now, before we go any farther, I want you to really lock this next point in your brain. It comes straight from Medline Plus, and it's so important. An abnormal result does not automatically mean you have a serious medical condition. It's just not a diagnosis on its own. The best way to think about it is like a check engine light in your car. It's a signal, a heads up that something needs a closer look. It's the start of a conversation with your doctor, not the end of the story.
So the basic idea here is pretty simple. Generally speaking, low levels of AST are what we want to see. That's considered normal. It means the enzyme is staying inside your cells, just like it's supposed to. High levels, on the other hand, may indicate that there's a health issue because it means something is causing those cells to release the enzyme. So what could actually cause high AST levels? Well, sure, it can definitely be things related to the liver, like hepatitis or cirrhosis. But remember what we said earlier? That AST is also in your heart and muscles? This is where that really matters. High levels could also be a sign of heart problems or pancreatitis, or even something like a deep burn, which causes a lot of muscle damage. This is why it's just one clue. not the whole answer.
And get this, it's not always a sign of a disease at all. A whole bunch of other things can affect your results. For example, a really strenuous workout can temporarily raise your AST levels because of all that minor muscle breakdown. Pregnancy can do it. Your age and sex can play a role. And of course, certain medicines can nudge the numbers up too. This is exactly why context is everything. And that really brings us to our final section, the bigger picture. Because the most important takeaway here is that your AST test is just one single piece of a much bigger health puzzle. It never tells the whole story on its own.
This is exactly why your provider will almost always look at your AST test right alongside another test for a different enzyme called ALT. Think of them as a team. See, ALT is another liver enzyme, but it's way more specific to the liver than AST is. So by looking at both numbers together, by comparing the ratio of AST to ALT, your doctor gets much better clues about what's going on and where the issue might be coming from.
And remember, at the end of the day, that number on your lab report is just a piece of data. Your provider is the one who acts like a data analyst. They take that single number and they put it into the much bigger context of your overall health, your symptoms, your medical history, everything. They are the ones who can truly interpret what it means for you.
So what's the most important question to ask your doctor about your results? Well, the whole point of this explainer was to empower you for that exact conversation. It's to help you move beyond just asking, is this number normal? To asking the much more powerful question. Looking at my overall health, what does this result really mean for me? Thanks for joining me.